Hi everyone, I'm Farzad Aghazadeh, PhD student in mechanical engineering, and I want to talk about automated and objective surgical skill assessment in this presentation. Firstly, let's investigate different types of surgery. In the left picture, you can see open surgery in which surgeons have direct access to body organs. And in the right picture, we can see minimally invasive surgery in which surgeons have some small holes called incisions to access body organs, and they can see the body organs with the aid of this monitor instead of direct vision. There are some benefits in this type of surgery. We have short recovery time, little blood loss, and little pain. However, surgeons need more technical skills since they need to convert this 2D image into 3D and build the 3D image of body organs. Also, they need to be familiar with these long instruments. Currently used assessment methods are checklists. Two of them are OSATs and also goals. Goals are more specifically developed for laparoscopic surgery, and you can see the key elements. Please keep in mind depth perception, bimanual dexterity, and efficiency. I'll go through them in the next slides. Considering that surgeons and residents have limited working hours, also the currently used methods for assessment are subjective, costly, and time-consuming. And let's say nobody wanna undergo surgical complications. An automatic and objective assessment method for surgical skills is mandatory. We wanna employ these two measurement devices to measure the parameters. We have motion capture system here and also eye tracker, as you can see. Another important issue is that the interaction between these two data streams is much more important to assess eye-hand coordination, which shows the motor functionality and the skills in that. Here you can see our surgical setup. It is our wooden box into which we can place our board, items, and graspers can move the items from left to right. It's a peg transfer task, which is a standard task in surgical domain and training. Also, we want to employ this circuit, and I built this circuit to have a synchronized data collection between motion tracking and eye tracking. I told you please keep in mind depth perception, bimanual dexterity, and efficiency. With the aid of markers and motion tracking system, we can convert these subjective parameters into objective and quantifiable parameters. Let's say depth perception can be measured with the aid of distance traveled along this instrument axis. Also, bimanual dexterity, like correlations between right and left instrument movements. So we can convert goals assessment, which is subjective, into an objective way. Also, eye metrics are proved to offer meaningful information about skills, and we want to measure blink rate, fixation rate, and pupil diameter variability. In this short clip, I want to show you how expertise is developed with the aid of eye-hand coordination. The participant tries to move these pegs from left to right, and the red circle shows gaze. As you can see, red circle arrives into the target in advance to tool, which shows our expert behavior. And this circuit is, as I told you, for data synchronization, and LED shows that data collection is started. After we collected our data, we need to extract some features. Let's say in kinematics, we want to have pass length, the total pass that instruments traveled, also mean velocity, mean acceleration, and jerk, and other stuff. In addition, we need to calculate eye metrics like blink rate, fixation rate. Blink simply is this motion, and we want to calculate pupil diameter variability. As I told you, interaction between eye and motion metrics is very important, and it shows the motor functionality skills, and I showed you in the previous slide. So we need to calculate the distance among instrument tooltip, target, and eye gaze. Eye gaze simply means the location that your eyes look at if you don't know the meaning. Later, we want to employ dimensionality reduction techniques like PCA that you can see this technique here to reduce the redundancy into our data set. Finally, we want to employ machine learning and those algorithms in machine learning like multi-layer perceptron, as you can see here, support vector machine for two class classification. Blue circles are experts, green circles are novices, and the other method is k nearest neighbors, and we can have multiple classes. Here we have two, let's say novices and experts. And finally, we can guarantee that one participant is qualified in technical skills, and after a knowledge test, we can guarantee that this participant is qualified for surgical operations, and we can ensure that you or any other person who want to undergo this type of surgery can feel comfortable with the surgeon. Thanks a lot for your attention, and I will be happy to answer your questions.